Hello, how are you? All my friends, patients, and colleagues. I am your doctor for spine. I am Dr. Hitesh Modi. I have done my orthopedics degree followed by PhD in spine as well as international fellowships. And at the moment, I am currently working at Zydus Hospital, Ahmedabad in Gujarat as a senior consultant in minimal invasive spine surgery and scoliosis surgery department. So basically today we have gathered here to know about spine surgery. Generally ऐसे बोलते हैं कि कमर का दर्द क्या है. So we want to get knowledge about back pain as well as what can be done if you, me or anybody is having back pain. So our talk and our healthy discussion basically comprised of common causes of back pain, what should we do to prevent back pain, and what are the causes and what are the prevention and treatment methods of back pain. So first of all, let me introduce that what is back pain or what is spine. So spine is, all of us know that it is basically a main structure of our body that stays in the backside, or we can say that reed ki haddi. So I will introduce a normal spine here. We can see that this is a normal human spine. This is a normal length, although this is a model. And we can see here that these are all vertebrae. These are one vertebrae, this is second, and in between that, there is a disc. So disc is like a cushion. What does it do? It gives us a motion, bending forward, bending sidewards, and also backwards. So these all motions are given by the spine. And if your spine is normal, you can walk normally, you can sit, you can bend, you can squat, you can sit cross-legged. Every activity is done with this, and the spine is very helpful structure in our body. It carries a lot of weight of our body. Basically, it has three main curvatures. First curvature in spine, that is in neck, that is cervical spine. It carries 7 vertebrae. Then thoracic spine, जिसको अपने छाती बोलते हैं, that is a thoracic spine, and the lumbar spine. There are 12 vertebrae in thoracic spine, 5 in lumbar. So from cervical to lumbar, we get motion, movement, everything. While when we sit, the sacrum and coccyx, 5 and 4 another vertebra, that gives us helping in sitting on a chair or sitting on a table, everything. So that sitting balance will be done with the sacrum and coccyx. If we see that between two vertebrae, there is disc, and the spine usually protects the neural structure, which is inside here, you can see. Okay. So this neural structure or nerves will be protected by the spinal column. So now if anything wrong happens, then what will happen? It will cause back pain, neck pain, that kind of symptoms. And if it gets worse, then the nerves or the spinal cord, which is inside and protected by the spine, it will get compressed. So if there is a pressure coming on the nerves, then the person will become a patient of spine, and he or she will have complaints of back pain, leg pain, as well as sciatica. That is usually happens when the person is having pain in lower limb or upper limb, arms or legs. Patient will feel tingling or numbness sensations. Patient cannot stand or sit for a longer period of time, and he has to take rest, he has to lie down. So these are very common problems. So the question comes that what are the things that can cause such problem, back pain or other problems? So if we discuss that the literature, or if you read many books, it says that by the age of 50 years of anybody's life, if he reaches to the age of 50, 90% of the population will have at least once or twice feeling of severe back pain in their lifetime. And the most common cause of this back pain is a muscular back pain. Muscles will get fatigue if you do overstrenuous work, if you lift heavy objects, if you becoming obese. So those things or those activities will carry more load on your back, and that is a usual results, usual cause of a muscular or paraspinal muscles back pain. It is a very common phenomenon. So you should not worry, you should not be afraid of getting back pain, because 70 to 80% of back pain comprised of this kind of back pain. And how do we treat it? So usually take some anti-spasm muscles relaxant medicines, some rest, some local icing or hot fermentation on the back. Those are the usual treatment for this kind of commonly occurring back pain. And again, you don't have to do those kind of activities again and again repeatedly with extra stress on your back. There are common things, common daily routine activities from which we can definitely prevent this back pain to happen. Such as, I will say, do not twist your body in much more severity. Do not do overstrenuous activity. Those are the things where you can prevent your muscle spasm and prevent your back pain. If you have back pain and if you want to prevent it, then do gentle exercise, light exercise, again swimming, cycling. Those kind of activities should be sorry, maintained in daily activity so that you can prevent back pain. What are other activities like daily routine? If you have to push and pull an object, then push is better rather than pull. Pull will give you more stress. If you have to lift heavy object should be nearer to your body. It should not be away from your body. If you have to work over your head, then you have to raise a platform. You have to climb on the platform so that your eye should match to the level of activity, and then you perform activity. If you work for long hours on computers, you should take rest for 45 minutes, 40 minutes, and do some gentle movement of the neck so that muscles will get activated and neck pain will be prevented. So these are very common and very common sense activities in that you can definitely treat with the back pain. Here now question comes, suppose a person is not having this kind of back pain. He is having more severe back pain where he needs to take certain treatment. So what are the common causes of this kind of back pain and back pathologies? So most common is disc herniation. जैसे हम बोलते हैं कि रीढ़ की हड्डी के बीच में जो गद्दी है वो गद्दी खिसक जाना है, तो उसकी वजह से नर्व्स पे दबाव आता है. So that is known as disc herniation, disc prolapse, or PID in common terms, prolapse intervertebral disc. So this is most common cause. Other causes are like lumbar stenosis, means रीढ़ की हड्डी के बीच में नस पे दबाव होना, जो जनरली ओल्ड एज, उम्र जैसे जैसे बढ़ती है हड्डी और उसके बीच में आर्थराइटिस बढ़ता है और उसकी वजह से नस पे दबाव आता है. So that is known as spondylotic arthropathy और lumbar stenosis, नस का दबाव होना. कई बार दो रीढ़ की हड्डी होती है, जैसे ये हड्डी है, ये रीढ़ की हड्डी है और ये रीढ़ की हड्डी है. नॉर्मल ये रीढ़ की हड्डी एक दूसरे के ऊपर लाइन पे बैठती है. इट सिट्स ऑन सिंगल लाइन. Sometimes what happens that one vertebra is moving forward. If it moves forward and the second vertebra remains behind, in that sense the hole which is causing protection to the nerves, that will compress, and because of that patient will have pain, and this condition is known as spondylolisthesis. Spondylolisthesis means one vertebra is moving over the other vertebra, that is known as spondylolisthesis. The other causes like person might have some infection in spine, some patient have fracture in spine, some patients is having pathologies like tumor, cancer, that is also possible in spine. And not last but not the least, the main cause in younger people or younger children, the crooked spine. You can say it as scoliosis or kyphotic deformity of the spine. The younger people is the future of the world, and they can have that kind of spine. So these are very common causes. We should know about each other. And so now we have a question from one of our viewer that they say, and I think the person is might be a patient of spine in past. The person has asked that does all spine surgery leaves a scar after the surgery? So my answer is no. All the spine surgery cannot leave scar behind, because there are two ways of technique. Previous days, the people were doing open spine surgeries where you need to put a big cut, open the muscles and do all the jobs and then suture it. And you have to take a big stitches. So those kind of surgeries will definitely leave a small scar. But nowadays, in advancement with latest technological status, we do this surgery with endoscopic technique and minimally invasive technique, where a very small hole is created on the back, and from the small hole we do whole spine surgery. We remove the disc, we do discectomies, we put the screws, and person is having very minor tiny scar or which can be taken below the skin. So person is not having many stitches over the skin, and it cannot leave a scar. So we can say it as a stitchless or scarless surgery. So because of advanced technology, we can definitely say that we can do the surgery without scars also. Okay. What's the question after this question? I would like to also inform about why the person is getting disc herniation or disc prolapse and what are the symptoms. So it's very common. When the disc is herniated on the back, it causes pressure on the nerves. Person will have back pain and leg pain. Person will have a tingling numbness, जैसे जिसको बोलते हैं कि पैर सून मार जाता है, तो वो symptoms दिखाई देते हैं. And person may not stand. Person will all the time remain on the bed. So these are the common causes. And how do we investigate? The simplest form of investigation is MRI. MRI is the best investigation modality available. We can do MRI of lumbar spine, cervical spine, thoracic spine, and get to know that the person is having disc herniation, person is having other problem. And treatment, yes, if person is having disc herniation with severe pain, initially we always, as a surgeon, we always try to treat those patients without surgery, with medicines, some sort of physiotherapy. And if person is not getting treated by the end of 2 to 3 weeks, 4 weeks time, and if MRI shows that the person is having disc herniation, then yes, definitely surgery is an answer. And how do we treat surgery? Nowadays, I would say most of the surgeries can be performed with endoscopic or minimal invasive technique, where we put a very small thumbnail size small hole on the back and we introduce endoscope, and through micro endoscope we perform all surgeries. Once the surgery is over, there is no stitch on the back, person shifted to the room, and after 4 to 5 hours we can definitely make the person stand and walk. So this is an easy surgery. Yes, definitely it's challenging, technical specialty is there, but person is getting a fantastic and wonderful result. Usually this can be taken as daycare surgery. We can discharge the patient next day after the surgery, and this gives an excellent result. Okay. We have again got one more question from our viewer, that what are the methods that we can prevent back pain? What do we do to prevent back pain? As we discussed previously also, that there are very simple commonest things where we can prevent back pain, that do not sit, do not stand, or do not do any activity continuously for hours and hours. After certain time like 40-45 minutes, you switch position, you take some movement, or 3 to 5 minutes you stand, you walk. So those are the activities. Do light jogging, light exercise like walking, cycling, swimming. Those are the activities, and some sort of physiotherapy, muscle exercise. These are the activities where we can definitely prevent back pain. So after this question, we have to again go that yes, endoscopy is wonderful tool, and we can definitely uh, uh, cure the patient. Now, in between, we got another question from our viewer that she is asking that can the person get paralysis after spine surgery? In fact, I would like to enlighten a viewer as well as all the people that this is a myth. We have to break the myth that spine surgery cannot lead to paralysis. And there are some cases like a person is having fracture of spine and before surgery he is having paralysis. Then it is true that after spine surgery paralysis in fact can be improved or it remains same, but it cannot worsen. After spine surgery to get paralysis is very rare. The chances of getting paralysis or some sort of weakness after spine surgery is less than 1%. So you should not worry about getting spine surgery. If you are getting benefit out of spine surgery, then yes, definitely you should undergo for spine surgery. Spine surgery cannot lead to paralysis. Again, one more thing, that how do we prevent and how do we check preventing paralysis during surgery? So in our hospital and recent technological advancement, we have neuromonitor machine. So neuromonitor machine will give a safe spine surgery because with using neuromonitor, we constantly observe and check the functions of all the neurological structures or all the nerves during the surgery. So if I am doing surgery with the help of neuromonitor, then I can prevent paralysis as well as I can monitor whether the functions of the nerves are getting improved. So at the end of surgery, I am 100% sure that person is not going to get paralysis as well as person is going to stand and walk in 1 or 2 days after surgery. And in fact, I can monitor the improvement in the surgery. So once the surgery is over, I am 100% sure that person is going to improve, patient is going to improve. So that is kind of confidence which we are getting with the help of neuromonitor. So I break this myth that person cannot get paralysis after spine surgery. Again, now we move further forward. Once we have seen that the surgery is possible with minimal invasive technique. So I have to enlighten you that what are the benefits of minimal invasive or endoscopic spine surgery. First of all, it does not leave a scar. It is done through very tiny hole. So it is a stitchless, scarless surgery. Second, it is done through endoscope. That means previously, if I am doing a surgery with a big hole, big scar, I can do with a small, tiny hole. So how does it help? It prevents the blood loss during surgery. So if there is no blood loss, no blood transfusion. Recovery is much more faster. In open surgery, we used to cut a lot of muscles. Here in endoscopic surgery, we don't cut muscles. We just dilate muscles. So there is no injury to muscles. So our all spinal structures are well preserved. So that's why recovery is much more faster and patient gets the benefit of surgery. So these are very common advantages of minimal invasive as well as endoscopic spinal surgery. So we have got one more person from outside that they have asked us care for the post stenosis or post-operative. I think post stenosis. So I guess that the question is about the lumbar stenosis. So lumbar stenosis is my next topic. Lumbar stenosis means getting pinched nerve. So once the person is getting older and older and older, the bones are getting degenerated. Because of those degeneration, the nerve canal for the nerves or spinal cord is getting narrow, and that's why the size of the nerve root canal is getting decreased, and patient is getting pain. The symptoms are usually same, but how do we take care? Yes, if I can treat those patients without surgery, that is the best. I give medicines as well as certain kinds of physiotherapy protocol, flexion exercises, some core stabilization exercises, core strengthening exercises, and isometric exercises, as well as sometimes muscle relaxant modalities in physiotherapies are available. Those are the things where you can take care of the stenosis, and this stenosis can be treated. If it does not get treated, then yes, definitely surgery is the answer, and we can do the stenosis surgery with endoscopic or microendoscopic technique as well. That gives excellent recovery, very fast recovery. And how do we take care? Even if you do surgery, how do we take care? So it's just light exercise. Walking is the best exercise to prevent further stenosis. So those are the activities where we can prevent this kind of activities, this kind of symptoms. Again, people are asking that the my one vertebra is moving over each other. That is commonly known as spondylolisthesis. And how do we treat those spondylolisthesis? Spondylolisthesis can be in initial phase can be very well treated with help of physiotherapy. If it doesn't get treated, then again minimal invasive surgery is also possible, where we put a small tiny holes on the back here. This is the front part, this is the back part. Here from the skin we put small tiny holes, and from small tiny holes we insert screws inside the bone, like this is a hole here you can see, and from this hole we can insert screws. So from those holes we insert screws in the spine, and we put the rods here. That entirely done with a minimal invasive endoscopic technique, and the spondylolisthesis can be treated very well. So this is again a surgical cause, and that's how we can prevent. And does all patients need surgery with the patient is having spondylolisthesis? I would say no. Only those patient who is having severe problem or severe pain, who cannot walk for more than half a kilometer or 1 kilometer, which previously they used to walk. So those cases needs operation. Otherwise, again 70% of the problem can be treated without surgery. That is a very important statement which I am giving to you. So spondylolisthesis or fixation of spine is also possible with this kind of technique. Our one of viewer from Tanzania asked us that what are the post-operative complications that can arise after spine surgery. So yes, any kind of surgery, suppose it's a heart surgery or limb surgery or abdominal surgery, any kind of surgery is inherently having some kind of complications. So spine surgery is having some kind of complications. Not all the patients, it's very rare, but some patients may get in forms of little bit of back pain, which is because of muscle damage. Sometimes fluid from the spine, that is a CSF, cerebrospinal fluid, may leak. Sometimes one of the screws might be touching to the root, that may hurt the nerve. So nerve injury is also possible. So those are very minute complications possible. If the person is having diabetes, blood pressure, uncontrolled diabetes, those may have higher chances of getting infection. Sometimes person's bone are very weak, so osteoporosis related weakening of bone can cause implant loosening or screw loosening, that kind of problem. So those are very minor complications possible. But yes, chances of getting complete paralysis or those kind of major complications are really, really very rare. So I do not want to make afraid of those complications after spine surgery. And yes, with latest advanced technological use of neuromonitor, navigational or computer-based surgery, these complications can be minimized to such an extent that actually after spine surgery, person does not have really a big complication. So don't worry about that, and person should get better after spine surgery. There is one more question that usually when patient comes to us, they all always ask me if I suggest them, I give them proper treatment for spine, physiotherapy, how to prevent it, everything is done. Person's pain is not going away. Significantly having back pain or neck pain or arm pain, and I suggest them surgery. Then usually they ask me, hey doctor, this is not my age for surgery. Do you think? So, like some patient comes at an early age, 20 to 30 years, and they need surgery. Some patients at an earning age, like they are doing a professional job at 40 to 50 years of age, and they need surgery. Some patients come at the age of 70 years, they are retired, enjoying a stay at home, and still they need surgery. So I would say that you should not believe that this is the right age or this is the wrong age of surgery. Surgery can be performed at any age in any patient, provided the person's symptoms are severe and it should match with the MRI picture. And if the doctor thinks that the person will get benefit out of the surgery. If you are getting benefit from surgery, or then yes, any age is ideal age. If you are not getting benefit for surgery after surgery, then there is no age for surgery. You should not do the surgery. So don't worry. At any age, surgery can be performed. Yes, according to age, the pathology and causes of spine problem will be different. Like in early age, the person might have disc problem. At an older age, person might be having osteoporotic or some other problem. At a younger age, person might be having infection, stenosis, or some other problem. So depending upon age, the person's problem might be different. But the ultimate goal of us is to improve person's condition and get rid of him from the back pain as well as from the sufferings which he has been suffering uh, from such a long period. So this is our primary aim to prevent and to take the person out of the spine problem. There are some patients who comes at an elder age. They have history of fall. They just doing some activity in house. The floor is wet and they sleep and they come with the back pain. So how do we treat and how do we diagnose? So usually when the person age reaches to the 60 or 60 plus, usually what happens that calcium level in our bone are going down because the calcium from the bone goes to the blood to maintain the blood calcium level, and that's why bone is getting weaker. So this condition is known as osteoporosis, and because of osteoporosis, bone becomes weak. So even a small injury can cause fracture in the spine. So those are known as osteoporotic spine compression fractures. So how do we treat? If person is having osteoporosis, so prevention is better than cure. So we have to always start with some anti-osteoporotic medicines. Usually we know as calcium medicines. So after the age of 50 or 60 in females and after the age of 65 to 70 in males, everybody should be given calcium medicines as well as anti-osteoporotic medicines. And how does it help? It will strengthen your bone, and that's how it prevents the causes of getting person into the osteoporotic compression fracture, and it makes bone stronger. That's how the pain also goes down. Suppose the person is having already fracture, then how do we treat? If the person is having osteoporosis fracture, initially some sort of bed rest for 2 to 3 weeks with pain medicines, with calcium, as well as some nasal spray or hormonal sprays taken through the nose, that is known as calcitonin hormones. So those will improve the quality of bone and decrease the pain. If patient is having severe osteoporosis, and how do we diagnose? So the test is known as DEXA scan. So DEXA, with the help of DEXA scan, we see the person is having severe osteoporosis. We start injection teriparatide hormones, and with those hormones, osteoporotic fracture can be treated. If the person is having severe fracture, severe pain, not getting treated with all those medicines, then how do we treat it? Then very simple, minimal invasive procedure where we even do not anesthetize patient. We just anesthetize the skin with a small injection. We introduce a needle, like if the person is having fracture here, we introduce a needle inside the vertebra bone, and we make this bone strong with the help of cement, that is known as bone cement, and the procedure is known as vertebroplasty or kyphoplasty procedure. So with the help of bone cement or vertebroplasty procedure, the osteoporotic fracture can be treated very well. After that procedure, within 1 hour, we can make the person stand and walk, and person becomes pain free. So this is how the technology and science has progressed. This is very important to know for all of us, and we should not be afraid about such kind of spine problem. I assure you that even this small kind of surgery make wonders in patients having back pain. So this is all about a routine problem, day-to-day problem. One foremost problem which I must mention to all our viewers is scoliosis. Like, we do see a lot of patients having scoliosis or crooked spine, like the spine is getting curved, and because of that, the person looks ugly, person is having lot more back pain and other problems. So that is a scoliosis condition which usually found in younger age group children. And if it found, yes, again, there are some sort of belts, some sort of braces available, where if it is diagnosed at an early age, we can treat it with the belts. If it doesn't diagnose at an early age, and if it progresses very rapidly and to such a degree that it can create cosmetically bad appearance, then yes, with help of surgery, neuromonitor, endoscopic technique, we can correct the spinal curvature with help of surgical correction. So these are roughly very common occurring questions, and I hope I have given you proper knowledge, and I hope to see many people, and I hope to see the treatment and getting the patient improved with the back pain. Thank you very much for listening to me. Dhanyawad. Thank you.